Hi, this is Dr. Michael Horwitz, and welcome to another episode of Podiatry Help Desk. This is the video series called Treatment of Peripheral Neuropathy. What we're going to do is follow a paradigm that I've created over many years that hopefully will help people act early if they discover numbness, tingling, and pain in their feet associated with small vessel peripheral neuropathy. So, we're going to start with step one. And step one addresses why many neuropathy treatments fail. So most doctors focus on diagnosing neuropathy, but they often don't have a strong treatment strategy. Neurologists, for example, often see patients very late in the disease when the symptoms are severe. And in my practice as a podiatric surgeon, I often see patients much earlier, and that's important because neuropathy is far easier to treat early than late. Step two, objective diagnosis. The diagnostic test that I rely on most is called a peripheral skin biopsy. This involves taking a tiny sample of skin from the lower leg. The laboratory can then measure the density of the small nerve fibers and microvascular structures of that particular biopsy. This gives us an objective diagnosis showing whether neuropathy is mild, moderate, severe, or not present at all. The reason why I'm less enthusiastic about other tests like nerve conduction tests is because they can be painful and they're not as accurate, in my opinion, as skin biopsies are. Skin biopsies usually take me no more than 5 minutes to do. There's a tiny little punch biopsy done in the lower leg, and then this biopsy is sent to a lab, and within 1 week we get results that help us better understand your condition. Step three, after diagnosis, what we're looking for here is the root cause. What's actually causing the neuropathy? Once neuropathy is diagnosed, the next step is asking, why is it happening? And we'll look at several important factors. Many of you have already researched neuropathy and understand diabetes, alcohol exposure, medication history, chemical exposures, chronic inflammation, swelling in the legs, arthritis, and spine problems, often referred to as radiculopathy, promote the symptoms of neuropathy, numbness, tingling, and pain. Many patients actually have more than one problem occurring at the same time. For example, a patient may have true neuropathy, small vessel neuropathy, plus nerve compression. Step four, the compression component. Now this is very important. It's an important concept that is often overlooked. Nerves can be compressed in multiple locations, including the tarsal tunnel in the ankle. Tarsal tunnel runs beneath the medial malleolus, right around the ankle, and a vein, artery, and nerve can get compressed, especially in patients that flatten too much, or what we call hyperpronate, and that can cause symptoms related to compression. Understanding that these symptoms occur because of this particular compression site are obviously very important when considering the entirety of diagnosing and helping people with this disease. So the tarsal tunnel is one particular area that is involved. Another area is the common peroneal nerve near the knee. Another important area is behind the calf muscle. Compression can cause symptoms that mimic neuropathy, including burning, tingling, numbness, and night pain. Step five, diagnostic trigger point injections. So here is a tool that I feel is extremely important and extremely simple. One of the tools that I use is a very small trigger point injection, and this is often referred to as either therapeutic nerve block or trigger point injection. These injections contain a tiny amount of local anesthetic and anti-inflammatory medication. The purpose of the injections is not to cure neuropathy. The purpose is mostly diagnostic. If the patient experiences dramatic relief, even temporarily, in the following 48 hours after the injection, it tells us that nerve compression is playing a major role. And that information helps guide the entire treatment plan. Many patients become true believers in our ability to at least comprehend, understand, and relieve symptoms after these shots, because this simple injection in the legs can often create incredible relief. And that's not to say that this relief isn't temporary, because it is, but the relief itself can be duplicated. And that often is a big morale booster. For the purpose of this video, I just want you to understand that this is a diagnostic tool, even though it does create relief, but it gives us a lot of insight as to what's going on with your lower extremity. This is an important step that is often overlooked by 99% of the people treating neuropathy. Step 6, rebuilding the vascular or neurovascular tree. So once we understand the diagnosis, you've had your peripheral skin biopsy, comes back a week or two later, and say you're moderate, okay? Once we understand this, the next goal is to improve the health of the nerve fibers themselves. Now, if your biopsy comes back mild, we even more aggressively pursue the proper actions to get you to the point where you are now attempting and often succeeding at reversing the actual damage. Mild is easier to treat than moderate. Moderate is incredibly treatable. Severe neuropathy is not. So, we want to improve the health of the nerve fibers themselves. I explain this to patients using a simple analogy. And in my waiting room, I have a plant where you can see the roots exposed. I meticulously took this bush and dipped it in water and cleaned it up so that all the roots are exposed. I'll show you a picture of this. The reason I do this is because neuropathy is essentially damage to the roots of the nervous system. And these nervous system roots look identical to the roots of a plant or a tree or a bush. So the goal is to rebuild that root system. So now we're going to get into step 7, which will address how we begin this process. I hope you find that this is enlightening and are happy to know that this is a relatively easy step. Near-infrared therapy. One of the treatments that I use is near-infrared light therapy. There are a number of different light therapies out there, and this can get very confusing. People often go to infrared light now as a general health benefit. That's a little different than near-infrared and using devices that properly introduce the right wavelength of light into the right area of the foot. A device that I commonly recommend is called the neuroma. And the reason for this is the structure of the device, the power of the light source, and how it drives light through the plantar aspect of the foot. You're probably not going to duplicate this therapy by finding some cheap online substitute. So I will tell you right now that it's very important to find the right type of infrared therapy device if you're going to implement home infrared light therapy. So this therapy, as I've explained, uses powerful red and infrared wavelengths. These penetrate into tissue, they stimulate nerve repair, and they improve the circulation around the tiny nerve endings, or if you will, the root endings of the nerve. Now, what's great about this is patients can use these at home typically. This is 20 minutes twice a day. The device automatically turns on the minute you put your foot into it, so I usually explain that this should be kept next to the patient's TV or reading chair or maybe work chair so that they can get in and use this therapy consistently. The key factor here is consistent use, which is why home therapy is so effective. You might have heard about anodyne or electrotherapies, stuff that needs to be done in a particular therapeutic laboratory or a doctor's office. This is highly inconvenient in my opinion. It's much more convenient to have something that truly works in the comfort of your own home and that you can compliantly use every day. Step 8 is improving circulation, because we also want to support the vascular system as we're introducing you to near-infrared light therapy. And one tool that we always use is nitric oxide. Nitric oxide supplementation helps dilate blood vessels, improve circulation, and deliver oxygen to the nerves. You can think of it as helping blood flow reach the nerves more effectively. As we talk about nitric oxide therapy, one thing I want to point out is though I make this sound simple, medical professionals should always be involved when it comes to any oral therapy. Now, this is very safe. In fact, many people take this as just a health benefit. You've heard of Super Beats. There's other products out there that have nitric oxide in them. It's well proven that these offer great solutions. And essentially they act like Viagra for the lower extremity when it comes to this near-infrared supplementation and how this works. But some nitric oxide supplements actually produce oxalates, and oxalates can cause kidney stones. So you should be careful when it comes to choosing the proper supplement, and that's why it's important to consult with your physician, because There are supplements that are oxalate free and that work better than others. And I am a big believer in nitric oxide, so that's where we'll leave it at this point. The combination of near-infrared light therapy with the appropriate device and nitric oxide is my go-to home treatment for mild and moderate peripheral neuropathy. So now we're up to step 9. Step 9 involves treating the entire nerve pathway. Neuropathy doesn't always start in the foot. Sometimes it begins higher in the nervous system, including the spine. Now, spinal compression is different than small vessel neuropathy, but oftentimes patients come in with both. One question that I constantly ask is, does spinal compression, say sciatica or cervical headache or any problem with the spine, actually contribute to small vessel neuropathy? Well, it can. Think about it. If it's preventing you from getting exercise or there's a certain amount of compression, it's limiting your movement in certain ways, it certainly should be addressed. One of the technologies that we utilize is a robotic cold laser called the ML7 laser. Now, ML has many iterations of this laser. The latest is the ML7. This is a company that actually holds the patents on cold laser technology that will not burn. And that's a very important consideration when using this technology. The technology is surprisingly effective at treating radiculopathy, back problems, shoulder problems, knee problems, hip problems, and obviously foot and ankle problems. This device works sort of by stimulating a pathway that involves the production and supplementation of mitochondria. Now, mitochondria, as some of you may know, is the cell that creates energy in the body, and it's the metabolism essentially of the cellular network. Think of it this way: amateur and pro athletes have a ton of mitochondria. You might ask, why do these athletes heal so quickly? They say sprain their ankle or even break a bone. They're healing at 10 times paces that are 10 times faster than the average person. This has to do with mitochondria, which are essentially the energy centers of cells. So what this technology does is it delivers this wavelength of light deep into tissues. We're talking 5 centimeters deep, much different than red light laser. Photobiomodulation is the scientific term that's been granted to this particular technology. However, it's overused because photobiomodulation essentially involves whatever you want to throw at a body part using near-infrared and infrared light. So ML7 is actually better thought of as a particularly special type of laser that delivers a pattern of light that is very, very effective at stimulating mitochondria, that helps tissues repair themselves and not only reduces inflammation, but actually causes healing. So in my practice, this has been very effective, not only for neuropathy, but for radiculopathy, shoulders, knees, etc. How we use it when it comes to small vessel neuropathy? Well, this is interesting. What we usually do is we use it higher up in the neurovascular tree or higher up in the body. If we're getting what we need from a home therapy utilizing a near-infrared light therapy like the Neuroma Calm, then what we want to do is we want to alleviate some of the areas that may be causing problems higher up in the body. And that's where ML7 laser therapy comes into play. Step 10, supporting the nervous system. So we also support nerve health with B complex or B vitamins because actually there are 13 different reasons for why peripheral neuropathy or small vessel neuropathy can exist. And one of them is the deficiency of B vitamin, caused primarily because the digestive system can't actually clear B vitamins or leafy vegetables that produce these B vitamins. Also, footwear adjustments. As podiatric physicians, we're always attempting to better correct the gait, which can help when it comes to compression issues like tarsal tunnel, etc. And of course, evaluating proper biomechanics. I work with a great physical therapist who evaluates full body biomechanics and has been very helpful in getting my patients to actually walk properly and exercise properly, stretch properly at home, etc. Sometimes patients benefit from less cushioning. That's interesting when it comes to footwear because less cushioning actually improves proprioception. So Getting into footwear, because we all like to talk about footwear, right? Proprioception is really important. What is this? This is the brain's ability to sense where the foot is in space. What we like about padded footwear is it's comfortable. What I don't like, and many doctors, including physical therapists, don't like, are arch supports that tend to essentially treat you as if you are exoskeletal, meaning your skeleton's outside the body like a crab or a lobster, instead of an intracellular species like a man or woman with an internal skeleton. Orthotics can sometimes cause a lack of proprioception. And I think in general, they're overly utilized. That's all I'll say about it at this point in time. We also like to use tools like proprioceptive mats. These are rubber mats that have rubberized little rock portions on them that patients walk across. And if you do this intermittently, maybe once a week, it helps you subjectively evaluate whether your perception, proprioception, and your reception or your nerve fibers are actually healing. So it's a great way to subjectively judge how this home therapy is working. Vibration plates can work if you have lymphedema, because often swelling or edema around the areas that are compressing nerves must be addressed. Stretching programs and walking programs are also very beneficial. All of these help retrain the nervous system, which is essentially very important. Neuropathy should be considered a complex condition, but with the right approach, we can often make significant improvements. The key is treating the nerves, the circulation, the mechanics of the body, and the entire nerve pathway. In the next video, I'm going to discuss what we do when neuropathy becomes moderate or severe, and the additional therapies that can help. If you're dealing with peripheral neuropathy in any form, I encourage you to watch the next video. I'm Dr. Michael Horwitz with the Feet for Life Centers. Thank you for watching. Please subscribe if you can, and comment if you wish, and we'll bring you another episode of Podiatry Help Desk.